The graying of America is an often repeated and familiar phrase which refers to the rapidly increasing number of elders in this country. By the middle of the 21st century, the number of people over the age of 65 is expected to constitute nearly 1/4 of our nation's population. This is of particular significance to healthcare professionals and educators, since elderly patients have their own unique set of healthcare needs. For example, geriatric assessment requires special interviewing and diagnostic techniques.
Where are we now? I didn't understand that.
Okay. Well, obviously you're having some trouble hearing.
Illnesses may appear or behave differently in elder patients than they do in younger people. And in fact, some conditions, such as osteoporosis, cataracts,
The lens
macular
sits
degeneration,
behind the iris.
and foot problems
Complaints was that I
occur
felt
almost
swollen and it was
exclusively
sore
in the elderly.
and it was very painful upon ambulation.
An older patient may be suffering from not one, but several maladies. What's more, their condition may be exacerbated by an array of medications they're taking, which have been prescribed by a number of different, unassociated physicians or other healthcare professionals.
Relative to the numbers, the sheer numbers of medications that elders take, that predisposes them to a higher likelihood of a drug-drug interaction.
How can our nation's healthcare professionals prepare for the ever-increasing number of elderly, which reaches a maximum when the baby boomers become elders?
Time for it, huh? They don't really care too much about it. They've got their own lives to live. They tell me about that home. Pretty nice place? No, it killed her. Killed her? What do you mean? That was a pretty neat place. That was one of the better ones I've seen.
Significant developments have occurred through the Geriatric Education Center's grant program, which was initiated in 1983 under the authority of Section 788B of the Public Health Service Act. Initially, 4 institutions, Harvard Medical School, the State University of New York at Buffalo, the University of Michigan, and the University of Southern California, were each awarded a 3-year grant to develop a prototype geriatric education center, or GEC. During the first 10 years of the program, a total of 44 geriatric education centers were established as a result of funding from the Bureau of Health Professions. Today, Section 777A of the Public Health Service Act authorizes the Bureau of Health Professions to fund programs to improve the training of health professionals in geriatrics, develop and disseminate curricula relating to the treatment of health problems of elderly individuals, expand and strengthen instruction and methods of such treatment, support the training and retraining of faculty to provide such instruction, support continuing education of health professionals who provide such treatment, and establish new affiliations with nursing homes, chronic and acute disease hospitals, ambulatory care centers, and senior centers in order to provide students with clinical training in geriatric medicine. One approach the GEC program uses is to train the trainer. Faculty and other instructors of healthcare professionals are trained in geriatrics at a geriatric education center. Then they pass their knowledge on to their students, thus creating a ripple effect.
So basically, I'd like you to think of working with elderly patients.
Another outcome of the GEC program is the development of geriatric programs both at the GEC institutions and by GEC trainees upon their return to their home institutions. Students gain knowledge which influences their future careers.
Back in the summer of 1988, I was driving up the freeway on my way to court. I was puzzling over a problem. How do I best serve the needs of my clients? I noticed they were more and more an elderly group. The radio was on, and I heard an interview about the Geriatric Education Center and the year-long Scholars Program. Now that sounded like a real helpful program. I called the GEC office and found that I was the first, up until then the only, lawyer to express any interest in the program. That clinched it for me, and I signed up. As the Scholars Program progressed, so did my commitment to serving the legal needs of the elderly. I joined an emerging lawyers group called the National Academy of Elder Law Attorneys. Happily, I had directed myself and my law practice into a quickly emerging field, and the GEC was there to help with my training. When I finished the year-long program, I came away with two vital things. First, a knowledge base on the medicine of aging, on the aging themselves, and on aging programs nationally. And second, a new network of professionals in the aging arena. I did not sit still. The San Antonio Express-News hired me to write a weekly column on legal problems faced by the elderly. I also began a speaking circuit to educate both professionals and the elderly community on the laws that affect them. To date, I've spoken at dozens of local events and many state and national events. Perhaps the most far-reaching outgrowth of my involvement with the GEC is my book, The Senior Texan Legal Guide. The first edition of the guide was published in 1991 and has reached thousands of care providers, elderly folks, and professionals in Texas and nationally. The second edition was published in early 1994, updated for all the Texas and federal law changes, and is also reaching a wide audience. As a result of the GEC's activities, I took a running start in elder law. The thousands of people who have benefited may not know about the GEC's pivotal role, but they've all gained because of its existence.
Practitioners receive training through workshops and seminars. This allows them to earn needed continuing education credits while learning the state-of-the-art in the care and treatment of geriatric patients. Curriculum development and dissemination is another outcome of the GEC program. Curriculum modules are created and institutionalized at the home institutions of the center. The Bureau of Health Professions periodically issues a listing of curriculum materials which are available from the GECs as part of the dissemination process. Affiliations are established between GEC educational institutions and nursing homes, chronic disease hospitals, ambulatory care centers, nutrition sites, and senior centers in order to provide students with clinical training in geriatric medicine. Geriatric education centers also offer technical assistance to healthcare facilities in developing geriatrics training programs for their staff members. Interdisciplinary team training in geriatrics is an integral concept in GEC program development. Teams of healthcare professionals problem solve on healthcare treatment and ethical
Primarily,
issues.
I try to keep patients from falling through the cracks.
Some centers focus on training practitioners who serve special populations.
Mama.
Some centers design their programs to reach healthcare professionals serving inner-city populations, while others provide training to both formal and informal caregivers in rural areas. No matter what the setting, the healthcare needs of the elderly require special knowledge and training. For example, nutrition and malnutrition are major issues relating to the older population. Nutrient needs change with age. Even for those with adequate resources, malnutrition may result from poor nutritional practices. For others, a more sedentary lifestyle, coupled with the diet from a more physically active time of life, can lead to obesity, a growing problem across generations in the country. Nutrition counseling presented in a sensitive manner is part of many GEC programs. Ethnogerontology is a particularly important element of the program. The diverse cultures represented by our elders must be understood and appreciated by all those who provide health care and other services. Communication takes on many forms, including tools for both readers of other languages and for non-readers. Innovative education approaches have been devised to teach professional caregivers to serve hard-to-reach and underserved populations, such as low literacy or non-reading populations, especially those of minority cultures.
Nails straight across, just like this. When Dr. Lopez was
Board games represent another innovative educational tool adapted to sensitize individuals and groups to such issues as families and aging, sexuality and aging, both developed by the Oregon GEC. The Aging Game and Gerontopoly, developed by Duke University and the University of Florida GECs respectively, and Geropody, developed by the Missouri Gateway GEC, are designed to promote understanding of the aging process through role-playing. Education concerning the stresses and needs of caregivers is an important facet of interest in training. Caregivers of elders can be children, spouses, siblings, friends, even parents, as well as professional caregivers. Elder abuse is an issue often poorly understood. While physical abuse is the best known, there are more subtle forms: financial exploitation, psychological abuse, and self-neglect. Some centers offer specific courses in detection of elder abuse, treatment, and counseling. Through the National GEC Network, these resources are available to all. Depression, confusion, and dementia are but some of the mental health issues that affect some elders. Even for those in good physical condition, the effect of mental illness can be devastating to patient and caregiver alike. As with other conditions, assessment, diagnosis, and treatment are integral elements in geriatric education programs. In Alzheimer's disease, for instance, an understanding of the stages of progression and prognosis is equally important for both family and professional caregiving. Rehabilitation and the activities of daily living geared to each individual's potential is an important component in the return to functional independence after a stroke or an accident such as a hip fracture. Clinical innovations in patient care in heart disease and other chronic conditions such as arthritis and diabetes are special foci of geriatric education programs. Collaborative efforts are a hallmark of the GECs, including a study of physician practice protocols of the Western New York GEC, the Alabama GEC, and the South Texas GEC. The distance education teleconferences coordinated by GECs in Florida, Virginia, and Oregon, and the Ethno-Geriatric Workshop for all GECs initiated by the Stanford GEC. Through training received at geriatric education centers, faculty and practitioners in virtually all healthcare disciplines can acquire knowledge of the special needs of aging patients. Practitioners of one discipline can also learn to interact with those in other disciplines, forming interdisciplinary teams. This leads to patient care which takes into account the possible multiple conditions and treatments which are frequently characteristic in the elderly. As you can see, the field of geriatrics is challenging to both educators of health professionals and the practitioners themselves. Bernice Parlak, Chief of the Geriatrics Initiatives Branch of the Bureau of Health Professions and formerly Director of the GEC of Pennsylvania, defines geriatrics this way. Geriatrics is by nature a multidisciplinary science and, in practice, an interdisciplinary collaborative art.